All right, guys. So for this week, we're going to look at our last unit, our last section of Unit 3. So we're going to look at the structures and functions of our sensory systems. So today, we're going to look at the eye in itself. So on Friday, we should have labeled the eye. And then today, we're going to look at some of those functions, structures, and disorders of the eye itself. Just know, so today we'll go over the eye. Tomorrow, you'll go over the ear. Wednesday, you'll go over the tongue and the um not the skin. We've already looked at the skin, so we won't really go into depth in that one. All the nose. So you'll look at the tongue and the nose on Wednesday. And then Friday, you will take your Unit 3 test. So remember that Unit 3 is a bigger unit and includes that digestive system, urinary system, the nervous system, which was big, and then our sensory system that we're going to look at the next 3 days. So it is going to include all four of those. So it is a bigger test because it is a big unit that is going to be remarkably big on your final exam. Okay. So we're going to start with the eye today. So this is going to be the structure of the eye itself. So we're going to start with looking at the functions of the inner eyes. So we have three layers here. We have our sclera, our choroid, and our retina. Our sclera itself is going to be the tough outer layer or the white of our eye. So whenever you see your eyes, you see that white part, that is actually going to be known as our sclera. It helps maintain that shape of the eye itself. And then you have extrinsic muscles that move the eye around that are attached in the sclera. So whenever you look left and right, those muscles are attached to that sclera to allow your eye to move. Then you have your choroid. This is going to be a vascular middle layer. This nourishes the outer layers of the retina through those blood vessels. So you can see here, this is going to be that choroid. And then you have the retina. This is going to be this big red circle here. This is going to be the innermost layer of the eye. Light rays do reflect in here to form images. So they contain the rods and our cones. So our rods and our cones, they are aligned on this back wall, kind of back here. Our rods are going to be sensitive to dim light. This is because those rods really detect those shades of gray, whereas cones are sensitive to bright light and color. So whenever you're driving at night, whenever you're squinting because the lights are shining right into your eyes, that's because those cones are being sensitive to that bright light. And then you have your optic disc. So this is going to be a disc right here. So you kind of see that little circle there. On the retina, this is known as the blind spot. Everyone has one. You just kind of got to find it. You can move your finger from like your ear over to your nose without moving your eyes at all. And there'll be a point where you cannot see your finger for a brief second. So we're going to look at some of the functions of the inner eye and those structures as well. So within that inner eye, we have our cornea. So you see here, this is going to be our cornea itself. This is going to be that circular clear area in front of the sclera. It is also known as the window of the eye. It is transparent and permits the passage of light rays. So the sclera kind of shapes that eye, whereas the cornea is going to be the window for that eye. And then you have your pupil. So this is going to be that circular opening in the choroid that allows light to enter the eye. So whenever light is entering the eye, that pupil is going to contract, so it's going to get a lot smaller. When the lights are dim or there's no light, that pupil is going to expand and then get bigger. So if you've ever done the test where you're standing in front of a mirror and the lights are off, your pupils are really big, and then you turn the lights on and then they go really small. That's just the pupil letting in the light into the eye. And then you have your iris. This is going to be the colored part of our eye. So whenever someone says have blue eyes or green eyes, hazel eyes, brown eyes, that is going to be the iris they're talking about. This does have our intrinsic muscles within the iris that control the size of the pupil and the amount of light that allows to enter the eye. And then we have our lens here. This is going to be a structure located between the iris and the pupil that separates the anterior and the posterior chambers and focuses the images for the retina. So within those anterior and posterior chambers, in that anterior, we have our 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 aqueous humor, a clear watery fluid that nourishes the lens so it doesn't dry them out. And then so this anterior is going to be on this front side here. The posterior is going to have a vitreous humor that is a jelly-like fluid that kind of just maintains that eye shape and refracts that light rays as well. And then you have your optic nerve. This carries those impulses that you see. So anything that you use to see, it takes those images and it is going to send it to the optic nerve, which is then going to send it to that occipital lobe, where we use for our eyesight and we determine what we are seeing. And then we have some functions of the external eye. We have the orbital cavity. This is going to be the cone-shaped cavity formed by the skull that houses and protects the eyeball in itself. So here would be like that orbital cavity here. It just kind of protects that eye, holds it into place. We have our eyelids. These are going to be those movable folds of skin that protect the eye, as well as the eyelashes that are on those eyelids. They're there to prevent large particles from entering the eye. And then you have your conjunctive. This is going to protect the membrane that lines the inside of the eyelids and covers the sclera. And then you have your lacrimal gland that produces tears, which cleanse and lubricate the eye. So here you can see some of those pathways of vision. So we have our eye seeing something. It is going to send what we see to that cornea, which is then going to send it to the pupil, which then sends it to the lens where the light's rays are reflected. Once they are reflected, they are sent to the retina, and then the rods and cones are going to pick up on that stimulus and then send it to the optic nerve, which is then going to send it to that occipital lobe to tell our brain what we are seeing. Remember, at any point in this video, you can pause it, take notes. I should have said that at the beginning, I meant to. But definitely pause, take notes, and then come back to it if you need to. So next we're going to look at some of the eye disorders, and then we'll wrap it up for today. And then, like I said, we'll do the ear tomorrow, and then the nose and the tongue on Wednesday. So our first disorder is going to be our cataracts. This is when the lens of the eye gradually becomes cloudy. So that lens itself is affected. This usually does happen in people who are over the age of 70. It does cause a painful gradual burning and blurring and loss of vision. Not burning, but it does cause blurriness and loss of vision because you have this cloud and you can't really see. And it does become worse and worse over time. The pupil in itself will eventually turn black or to a milky white to indicate that you do have a cataracts. And a lot of times you'll hear people saying they got their cataracts removed. They can do this by having a surgery as well. And then you have color blindness. So here, if you cannot see that there is a number in this circle, that means you do have a color blindness. But it does affect our cones. So remember, those cones are going to see those colors. This is a genetic disorder that is carried by the female and is usually transmitted to the males. It is way more common to be seen in males than it is in females. It is kind of hard to distinguish between if it is the red or the greens that are being affected. And then we have our conjunctivitis. This is going to be commonly known as our pink eye. So that's going to inflame that conjunctive. So you have like the redness of the eye, pain, swelling, and usually you have like this discharge coming out. This is a highly contagious disorder. So if someone has pink eye, they rub their eye, they could pass it to you. And then you do need an antibiotic eye drop to get this cleared up. And then we have something called a detached retina. This is going to be an emergency situation where the retina pulls away from the layer of the blood vessel that provides it with oxygen and nutrients. This is something that you do have to get surgically repaired. The longer the retina goes detached from its nutrients, the greater risk you have of permanent vision loss. Some of the warning signs that you may have of a detached retina is going to be sudden appearance of floaters and flashes and reduced vision. Now, not to say that sometimes if you see a floater, that does not mean you have a detached retina. You do have to have like flashes and reduced vision as well. And then we have our diabetic retinopathy. This is going to be complications of diabetes that affect the eye. This is caused by the damage of the blood vessels of the retina. So sometimes you can see those floaters, you'd have blurry vision, impaired color vision, dark or empty areas in the vision, and vision loss. As time goes on, this can result into blindness. There's not really a cure for it. Something you just have to you deal with, and then as it gradually gets worse, it can lead to that blindness. Next, we have our glaucoma. This is going to be an excessive pressure causing disruption of the retina and the optic nerve. So this is going to be caused by overproduction of that aqueous humor or lack of draining. So some of those symptoms are going to be mild aching, loss of your peripheral vision, so you can't really see to the sides when you're looking forward. And then halos around light. So if you look directly at the light, you'll see like the circle that surrounds it. Next, we have our macular degeneration. This is going to be the leading cause of vision loss. It is an incurable eye disease in itself. It happens when small central portions of your retina wears down. It usually happens to people who are older and like 55 and older, who have had it in their family history. And then it is more common in Caucasians and for individuals who do smoke. So for some of those symptoms, you have partial loss of vision, abnormality where straight lines appear wavy or blurred vision, and then loss of that central vision in itself. Like I said, there's no cure for this disease. You can only just treat these symptoms and kind of have surgeries to kind of repair some of those symptoms, but you can't cure it. And the last part we're going to look at today is going to be problems with focus. So we have myopia. So this is where we are nearsighted. So light focuses in front of the retina because the eyeball is too long. So you can see here that the eyeball is kind of stretched out where normal vision is kind of circular. Our nearsightedness is stretched. So the lens concaves itself. Laser therapy can be used to reshape the eye and the anterior cornea of the eye. And then we have our hyperopia or our farsightedness. This is going to be light focuses behind the retina because the eyeball is too short. Objects may be moved farther away from the eye to be seen clear. So here you can see where that eyeball is kind of squished. So these are for people who have to move, like say if you have a book normal length, they're gonna move it out when they're farsighted. Say if you have a book normal length and you move it in, that means you're kind of nearsighted. And then we have our presbyopia. This is going to be old-sightedness. This is going to be when lenses lose elasticity and cannot focus on close or distant objects. This usually occurs after the age of 40, and this is where people usually get bifocals so they can see near and far. And then lastly, we have a stigmatism. This is going to be a irregular curvature of the cornea or lens causing blurred vision and eye strain. You do have to get some corrective lenses for this. That way you can be able to focus on what you're trying to look at. So this is going to be what we wrap up for our eye today. And then tomorrow we will look at the ear. Make sure you do start studying for that test. It is going to be on Friday. Like I said, it is bigger. Okay.